This video from the latest EACPT focus meeting concerns safety of medicine in children. I'm in Croatia, in Opatija, for the EACPT focus meeting on how to assess medicines.
My name is Suzana Matanović. I'm a specialist in clinical pharmacology from a big university hospital in eastern part of Croatia and assistant professor of clinical pharmacology and alternate Croatian delegate at PDCO in European Medicines Agency. I gave an overview on pediatric drugs in the history, an overview of today's situation and the perspective in the future.
Could you start by saying why we should be concerned about risk for medicines with children?
Because we know that children have different pharmacokinetics, different pharmacodynamics comparing to adult population. So if we, for instance, treat a child who has 5 kilograms with 5 milligrams of drugs, because we treat an adult who has 100 kilograms with 100 milligrams of a drug, it doesn't mean that we will treat the child the right way. It means we can use the drug, we can give the too small dose, or we can give the wrong formulation to a child with perhaps some excipients that are not allowed to be used in children.
And can you give some examples of classes of treatment where there have been some serious adverse drug reactions?
Some drugs have some adverse drug reactions in children that do not happen in adults, like Ray's syndrome with aspirin use, or increased risk of suicide-related behavior when using antidepressants in children, or tetracyclines when they are used in children. They have some adverse drug reactions on skeleton and on teeth. During the history, we unfortunately had many cases of disasters that led to death of hundreds of children, and we have to prevent that. There was an opinion that it's not ethical to do clinical trials in children. Nowadays, we know that it's not ethical to treat children with drugs that are not tested.
Now in the 21st year of the European Medicines Agency, which aims to regulate medicines for effectiveness and safety across the 500 million people in the European region. So can you tell us something about what regulations have now been coming in to try to help improve the focus on children and safety in medicines?
So this regulation came into force 9 years ago. I think it's still in perhaps at the beginning, because we have many plans for development that will help in the future, but now we have a certain number of drugs that are registered for pediatric population because they are tested in this population. And I'm sure that the real benefit we will see in the years ahead.
And in relation to the pipeline, there have been many plans, but not many so far have actually got through the full permissions process. What have some of the issues been which have led to difficulty in progressing from plan to permission?
I think it's because some of those pediatric investigations plans that have already been agreed, perhaps some of them apply to drugs that have been perhaps stopped in adult population, and some of them are about drugs that are going to be registered maybe in the future, in the next few years.
Thank you very much indeed. Thank you.
Thank you.
The next EACPT Congress will be held in Prague at the end of June 2017. See our website for more details, www.eacpt.eu.